I've researched what can happen with bleomycin because I have asthma, and that was something I had to consider going into the treatments. Everything I was seeing was adding up to it being toxicity, and so I had to speak up for myself, and it was hard, but I did it.
The importance of that just can't be overstated. And I meet so many patients who, well, they told me not to worry, or my doctor told me to come back in 6 months, and I was getting worse and worse, but I was told not to worry, and I was told it was something else. So congratulations for knowing better.
I was first diagnosed with Hodgkin's in 2018 when I was 28, and I was working a lot of hours. So I was very tired, just like Sam mentioned, but I didn't think much of it. I had weight loss I was trying, I was on Weight Watchers, but it never worked before, and then just suddenly started working. I had shortness of breath, and then at one point I almost crashed my car because I had a vertigo episode. So I ended up going to the doctor, and they told me it was just stress. And the only reason I got diagnosed with Hodgkin's was I eventually had a lump come up on the base of my neck on the left side. And I went to the urgent care. They told me that I just needed antibiotics, but there was something in their eyes that told me that wasn't all I needed. So eventually my family forced me to go to the ER, and we got a full biopsy done. I was in the hospital for the first time. And then, long story short, I had stage 2 Hodgkin's, and I also did ABVD. And about halfway through, we had to drop bleo because I had toxicity. Yeah, and then I was re-diagnosed with Hodgkin's in 2019 as well. After I think it was my 5th chemo, I think it was right before the new year, I remember it. I got the chemo like I had, 4 other times, but I went home and I spiked a really high fever all of a sudden. And, as a cancer patient, if it's like 100.4 or 3, you have to go. So mine was like 102, and my husband's like, we're getting in the car. And I was very lethargic and just not feeling well. So we ended up in the ER, and they told me I was septic. And so, of course, my mom heard that as well. Like, she was watching my daughter and just, freaking out because it's not good when you're septic. And they actually put me in the ICU. And I was in the ICU for at least 2 days. And the symptoms I had kind of dissipated after a few hours. I was feeling better, not 100%, but they started giving me antibiotics around the clock. And I had a feeling that it was something to do with the bleomycin, because I've researched what can happen with bleomycin because I have asthma, and that was something I had to consider going into the treatments. Everything I was seeing was adding up to it being toxicity, but there was nobody at that hospital who really treated cancer patients. Like, they came in and out, but they weren't there all the time. And it took about 4 days for my oncologist to actually come see me. And in that time, I pretty much diagnosed myself with bleomycin toxicity. I also stopped accepting the antibiotics because it wasn't an infection. It was a reaction to this drug, and ended up being that, yes, it was toxicity. It was confirmed later on. And I also had a pulmonary function test, and I think I had like a 30-point drop or something. And I am happy to report that I have regained a lot of my pulmonary function now, this many years out. So I know a lot of people, that's something scary when you do go through this. But yeah, and that, the doctor was speaking of, you need to advocate for yourself, especially when you're in a situation where your cancer probably better than the people that are there immediately. Like, it's not your regular care team. This was just a local hospital, and they had never seen this before. And so I had to speak up for myself, and it was hard, but I did it. Yeah, I mean, to be honest with you, I was not a great advocate for myself when I first got sick. I mean, the oncologist I ended up with was the one that was just walking by when I was in the ER initially, and I thought it was fate. It wasn't. He immediately upon meeting him in his office, he told me it was a good cancer, all sorts of things. In my case, I was like a unicorn of the Hodgkin's. Nothing went how it was supposed to go. It wasn't good at all. And sometimes I was quiet about it, or I didn't know what to do, because he was very I always looked things up, and he would call me Dr. Google, but not in a nice way. And so I was scared to bring up a lot of things. So I would tell you, if you are a young person and you are scared, or even a young woman, sometimes it's when you're a girl and you have a male doctor, sometimes it can be intimidating. Bring your family with you or somebody else you trust and have them speak up for you if you are scared to do it. I know a lot of people do that, and it's helpful because when you're inside of that room listening, your mind kind of goes fuzzy and you don't even know what's going on half the time. So it can be the difference between having a good result or ending up, pretty much needing a transplant like I did. I truly believe that if I would have been a better advocate, that I might have not needed one.
Totally. First, I'm just going to echo what you said, like how you knew better and how you listened to your body and you didn't take no for an answer and you sought something that made more sense to you. The importance of that just can't be overstated. And I meet so many patients who, well, they told me not to worry, or my doctor told me to come back in 6 months, and I was getting worse and worse, but I was told not to worry, and I was told it was something else. So congratulations for knowing better.
Especially when you're young, I feel like a lot of young people don't, it's hard sometimes to speak up, but even if you're young, you know your body.
Maybe even especially if you're young. Listen, we all know that old docs sometimes don't have the best reputation for listening to young people or trusting them, or taking them as seriously as they ought to be taken. So doubly so because of your youth at the time. In terms of setting the stage for where Hodgkin lymphoma therapy is at now and how we got here, I would say that historically, like back in like the 80s, 90s, the 2000s, to do clinical trials to try to make Hodgkin lymphoma better was all about intensification. Back then, it was all about intensification. How can I ratchet the treatment up to make it even stronger, even more toxic, but even stronger against the lymphoma? And we were sort of climbing that mountain of pushing to see just how much chemo we should cram into someone's gullet in pursuit of a cure. Because all we had was chemo, so what you want to do was more. We've really come over the other side of the mountain now, and we're in a very different place as a discipline, lymphoma experts in the field. And we've moved away from intensification, and now we're into de-intensification, personalization, and leveraging treatments other than chemotherapy as we try to help both maximize the chances of cure and minimize the short and long-term risks of our treatment. And we've gone away from uniformly using this ABVD cocktail, which remains a very good treatment and a very commonly used treatment. And now we're using more often other adjunctive treatments like a medicine called brentuximab vedotin, or Adcetris as its trade name. We'll talk more about that this evening, in lieu of the bleomycin that you heard both Chelsey talk about potentially injuring their lungs, leading to cough or shortness of breath. So we're finding ways to cure more people and at the same time cause less harm along the way. And that's really where the future of Hodgkin lymphoma is going to take us. I think that number one is to say that a lot of the drive to develop these newer treatments has been informed by our understanding of late effects and of cancer survivorship, and understanding well the risks that survivors of Hodgkin lymphoma treated with more traditional treatments go on to face. So that's been a lot of the driving force behind these efforts to improve our treatments. And yet we still need to follow with these newer treatments to watch for the possibility of late effects. We don't believe that they're going to cause as many or as severe, but part of the work of survivorship is learning from our survivors and walking that path with them as we see how their lives unfold over the years and decades to come.
I think that the main thing I struggle with that is the most apparent in my everyday life is probably the cognitive side effects from just all the different treatments. And I honestly think from the extreme stress that I was under for so long, I was so I was on this job at an insurance company and I had to balance things with legal documents. And I just know that if I were to go back to that job, I would not be able to do it now. And that's taken me a long time to see that that's okay and that I still am me, just have to kind of work with things differently. So physically wise, I have, fatigue a lot of times, joint pain. I often joke that inside I'm 80 years old, but on the outside I'm in my 30s. So it feels like that. There's a lot of like identity crisis that you have as a cancer patient. You're like, who am I now? What happened to the old me? What can I do? And I really want to encourage people to seek community, because I think that once you hear from people that, you know, they feel the same way you do, like even just hearing from Sam, I'm sure some of you are like, oh, other people feel like that. That's definitely what inspired me to start making art and connecting with others. And it can truly make a difference in your long-term just mental health in survivorship.
The number one thing that I would encourage survivors to do is to work with your care teams on developing what's called a survivorship care plan, which is a document. It could be a paper document, it could be a digital document, but it should be something that lives with you, that says what your diagnosis was, what your treatments were, and what our understanding is of what you can be doing to safeguard your health in the years to come. And that's informed by understanding what the possible long-term consequences of the treatments that you personally received, and how we think as doctors you're best served by taking care of yourself, and what we can do as doctors to prevent or reduce the risk of those problems as you go on to live your lives